Today we are very fortunate to have one of the leading hip experts on our show, Dr. Mauricio Herrera. Welcome to the show.
Thank you.
Explain to our audience a little bit about hip replacements, why they're needed, etc., with your model of the pelvis there.
Well, the basics of the hip is that the hip is a joint, and a joint is a ball inside of a socket. And in this model, you could see what a general hip will look like, and this is what a normal hip would look like. The ball is nice and smooth. You have cartilage layer here. The cartilage covers the bone, and that fits in the socket quite nicely. But what can happen is, such as in a situation when a patient does take corticosteroid, be it by mouth or via injection, the blood supply to the ball portion can actually die, and the bone can die. And the term for that is the avascular necrosis. And unfortunately, when that happens, when the blood supply gets distorted to the ball portion of the hip, this will die and the joint won't work like a normal joint anymore. The patient will have a lot of pain and discomfort and disability because of that.
And therefore, it has to be replaced with a mechanical type.
Correct. And so when something bad happens to the hip joint, then we are able to do an artificial hip replacement, which it involves, it's called a total hip replacement. When you change the socket and you change the ball fits in the socket, and that's what the new joint looks like. And that's what a total hip replacement is.
Now, this is the hip that Depuy manufacturers, but this is the one that was recalled, right?
Correct.
Because it has too much
yes,
metal
you can actually see all the erosion of the metal on the implant.
Yeah, what kind of metal is that?
It's called cobalt chrome, which is just a combination of different metals melted together.
Now let me ask you, when the FDA approved this, there was no way for them to determine over a period of time that it would end up with this kind of result.
Correct. Correct. Many times companies, when they put forth an implant, really won't know 20, 30, 40-year follow-up, unfortunately, with how a hip is going to do.
Yeah.
But unfortunately, this particular hip did have a high rate of failure.
Is Ryan's case a typical case where you have too much corticosteroids injected into the hip?
Yes, actually it's a very common occurrence, this avascular necrosis, or when the bone's blood supply gets distorted. Unfortunately, many patients do take corticosteroids for various reasons, especially asthma. Asthma is the #1 reason why someone would have to take corticosteroid for treatment, and so avascular necrosis is more common than you would think.
Okay, great. Well, thank you very much for being on the program. You've provided a lot of valuable information.